All right, so being Swiss, we can start on time, and for those who will join later, you will miss my part, which is the least important, because it's our immense pleasure to welcome Professor Maciej Goniewicz to hold the talk about the toxicity and the benefits and harm of e-cigarettes. And I'll do a quick introduction. Professor Goniewicz is toxicologist and pharmacologist that earned his PhD in Poland, then went to UCSF with a team of Neil Benowitz, and then at Queen Mary in London before joining Roswell Parks in Buffalo, New York. And you might wonder why the BHAM, because we are the institution who we invited Maciej, why we do that. And as you know, we're working in smoking cessation and also studying these novel devices. And before we smoke, we didn't have really to study the toxicology of it. It was just bad and people should not smoke. And now with these novel devices, the e-cigarettes, tobacco toasters, the snus, and so they have lower concentration of toxicological substances. And it's really now important for us to have a deep understanding of it. At BHAM, as primary care docs, we're also trying to be always the dumbest in the room. And with Professor Goniewicz, we definitely met that goal. So he's a leading expert both on the toxicological side, developing novel methods in the lab, and then doing also clinical studies and also epidemiological analysis. He's one of the, as you know, it's a very tense field, the e-cigarettes, people go ballistic, reasonable people, scientists really shout at each other on this theme, and it's rare to see researchers like Maciej who are really rigorous on just publishing the independent research they find out of their study. And his work has been acclaimed by both the proponents and the opponents of e-cigarette. It's really for us the most important research to just show what the data is showing and then let the policymakers do their job based on these data. He's also, of course, advising numerous institutions like the FDA and WHO. We are really blessed to have him now join us. And without further ado, I led the word to Maciej just before some organization comments. So he will speak for 45 minutes. Please keep your questions for the end. If in between you have questions, please write them in the chat. We look forward to hearing you now, Maciej.
Thank you so much, Vito. Thank you so much for the invitation. It's a great pleasure to be here. I don't know if you can see behind me is a beautiful winter day in Buffalo. I think you probably have snow too. Thank you so much for the invitation. It's a great pleasure to share my some of my results from my research and some of my thoughts about the electronic cigarettes. And today I want to focus on the respiratory implication, respiratory consequences of vaping. What do we know? What is unknown? What we might expect? What might show up in the future if people would be using the product for a regular time over years. And you know, in a context when we think about that, as Rita mentioned, from tobacco cigarettes, there's years, decades of the research on the respiratory effects of smoking. You know, there is no doubt about lung cancer risk. There is no doubt about COPD, asthma, any other respiratory conditions in the smokers. This is one of the most damaging tobacco-related diseases that we see, and also some of the symptoms that we see actually very early in the smokers. With the electronic cigarettes, when the product has been introduced on the market about 10 years ago, about 12, 13 years, depends on the country, this is a new product. So the data on the relative toxicity and absolute toxicity and the health risk of the constituents in the product is very limited. So we really started from the scratch. We try to understand what's in the product, what the users inhale, what is the composition of the aerosol that is being inhaled, what is the effect of this inhalation pattern on the users, and how it may translate to the potential health risk. When we started research a few years ago, even this simple challenge, there were no users, not so many users at that time to recruit for the studies, to do the respiratory tests. So we had to breach the laboratory science, the basic science, testing in vitro, in vivo, and finally moving slowly towards the clinical trials and the population-based science to understand the complexity of the problem. And I just want to make one more disclosure. I know that some of you might have heard my talk 2-3 days ago in Lausanne, so I apologize. Some slides might be the same. I would try to try to focus on the inhalation toxicity today, but some of the results that I will be presenting and some of the graphics are the same. So I apologize if you have to listen to this again. So let me start with this, the principal question that has been asked from the very beginning when the electronic cigarettes emerged on the market. Are those products safe? And this question is being asked by the users, by the vapers, is being asked by the clinicians, because they want to understand what to recommend to the smokers, to the patients. And it's being asked by the regulatory agency who, were challenged with this new product. And at the beginning, it was not clear what to do. Some regulatory agencies were very strict and say, we don't know anything about the risk of the product, so we are banning the product. We don't allow the product on the market. Some regulatory agencies were more open to that. They tried to either regulate it as the cessation, as a medicinal product, or like here in the US, the product came into the umbrella of tobacco products and is currently overseen by the FDA as a tobacco product. But when we're talking about the safety and the risk, including the inhalation risk, there are kind of two important directions and two important points of view. The one is the absolute risk of the product. So when it comes to the intrinsic harm or intrinsic risk associated with using that product. And then our comparator for estimating this risk is simply nothing. It's just inhaling the pure air when it comes to the respiratory health. So what is the risk, additional risk that the using these products may bring us to the risk that everyone has, the risk that we observe in the general population? It has very important implications to understand the potential risk in the young people who start using electronic cigarettes without a history of smoking. They're starting with the healthy lungs, they're starting with the healthy respiratory tract, and now they start inhaling these new products. And what might be the implication for that group? It's really concerning trend here in the US. More and more young people are trying electronic cigarettes. We see a population of the young people who just using electronic cigarettes on a daily basis, and they're using the product extensively. They consume a lot of e-liquids, a lot of pods with the nicotine, and they never smoke. They say that I never smoke. They never met our standard criteria of the past smokers, smoking like at least 100 cigarettes in their lifetime. So they become a new users of the electronic cigarettes. And we need to look at those group, and we need to understand what might be happening to their lung and to their respiratory health. On the other hand, we know that many of the users of electronic cigarette users, especially those in the middle age or older, they use the product as a substitute. They use the product as a cessation tool. They very often tried many other nicotine replacement therapy or smoking cessation drugs. They did not succeed. They are looking for another chance to quit smoking. They're looking for another opportunity to help them stay away from addictive combustible cigarettes. So that's how they see the electronic cigarettes. That's how they see the product as a chance to reduce the risk, to reduce harm from the smoking. And that's another important question. You know, do they lower the risk if they switch either partially or completely to vaping from smoking? Is there really any benefits to their respiratory health? And I will briefly go, because it's about bridging or connecting the dots between what we know about the product, what we know from in vitro, animal, and the human studies to the potential individual and population health effects. So I will go briefly from the left to the right and give you a very brief overview what we know about the risk of the product and the safety of the product, but I will focus on the respiratory effects. So what's in the product? Are there any respiratory toxicants in electronic cigarettes that would be of potential concern? So of course, this is nicotine delivery device. So whatever health effects associated with nicotine we might see from tobacco cigarettes or other inhalable products, then we might expect also in electronic cigarettes. We know that nicotine is not the primary culprit for the respiratory diseases in the smokers. There are other toxicants in the tobacco smoke that makes much more harm, and they have been linked to the lung cancer, COPD, or asthma and other respiratory symptoms. But nicotine is a drive of the use of the product. This is why the users are using this. This is the rewarding symptom. So it will be responsible for the patterns of product use. It will be responsible for the frequency of product use. So we need to look at the nicotine effect as well. And we know that the respiratory route of inhaling the nicotine is one of the most effective way to deliver the drug to our systems. You know, the nicotine replacement therapies like patches, like gums, they do not deliver nicotine as fast and as effectively like the products that are designed for the inhalation. There are solvents in the product, but there might be some impurities in the solvents. Something that is really interesting to me and what we study right now in our labs are the health effects of the flavorings. Those products came in different flavoring options. What creates those flavorings, the sensory aspect of vaping, are the chemicals that are being put in a product, are being used in a product by manufacturers to make the product appealing, to make the product nice for the users to inhale or smooth to inhale. And you can buy electronic cigarettes with whatever flavor you want, starting from the classical tobacco flavor to menthol. But the most popular products are actually of fruit and sweet flavors. And many of those chemicals have been tested for ingestion safety, have been tested for safety when they are using a cosmetic, so some dermal toxicity, but we have very little data on the inhalation implication or inhalation consequences of the flavorings. And there might be contaminants from manufacturing or storage process. This is the consumer product. You know, it might be exposed to the light, it might be exposed to the high temperature when stored. The manufacturers and the users may manipulate with the product. So there might be some potential for introducing dangerous chemicals, toxicants into the product. But what is concerning is that it's not only what goes to the product during the manufacturing process, but what is emitted, what is generated from the product when the user is using the product. And here are the major I think the group of the chemicals that have been studied extensively in electronic cigarettes are the carbonyl compounds, are the byproducts of thermal degradation. So you don't see those chemicals in the product itself, but when you look at the emissions, when you look what's in the aerosol, you see some of the respiratory toxicants like formaldehyde, acetaldehyde, that are being emitted from the product. And this is kind of similar to what we see in the tobacco smoke. You know, there are chemicals that you don't find in a cigarette itself, like carbon monoxide. We don't measure it in a tobacco cigarette, but carbon monoxide is emitted from combustible products because there is a combustion, because there is the pyrolysis of the organic material, and it burns and it emits the products of the thermal degradation and a combustion from the product. So carbon monoxide is kind of equivalent here to better understand the situation. So what do we know about what is emitted from the products? So when we look, when we take the product apart, when we connect to our smoking machines, to our generators of aerosol, we can generate aerosol. So what you saw in the flask, this is actually the aerosol, the droplets that are emitted from the devices and are being inhaled by the vapors, by the user. So that's what gets to the respiratory tract. That's what will interact with the respiratory cells. That's what will go, that can be deposited in the lungs. So when we look at the composition of the aerosol emitted from electronic cigarettes, it is commonly referred as a vapor by the users, and this is the term that is also used in the literature. It's not the technical term that we should be using, but it's just how it is. It's the English-speaking users just refer to the act of inhaling as vaping, and they refer to the emissions as a vapor. So what we see in this aerosol is those are the formaldehyde, acetaldehyde, acrolein. That's what I mentioned are the examples of the carbonyl compounds, or the toxic carbonyl reactive species that are generated from the product. They are generated because of the solvent for nicotine, including propylene glycol, vegetable glycerin, the common solvents that are used for dissolving nicotine in a solution for electronic cigarettes. Those solvents are heated, and once they are heated, they decompose and they generate those chemicals. And we know that many of those chemicals are toxic while being inhaled. It might be the subacute toxicity, some irritation, it might be inducing the coughing, but some of them are also suspected human carcinogens that are classified by the agencies as the cancer-causing chemicals to human. We see some impurities from extraction of the nicotine, some organic solvents that might be toxic when inhaled, like for example, toluene. We see traces of nitrosamines as well in the emissions. The nitrosamines are of concerns when it comes to the lung cancer risk, because those chemicals have been shown to damage DNA, and they are culprits they've been associated with that. There's actually a very strong association between exposure to those chemicals and the lung cancer risk. What I want to emphasize, if you look at the range in electronic cigarettes, this is estimated for 15 puffs, kind of like a session of puffing on electronic cigarettes. You can see a huge discrepancy and huge variation across the products. So some products have very low levels. Some products do have a significant levels of those toxicants in aerosol. So it's really important to understand what's drive those discrepancy. Why some products generates much more of the toxicants, and why some products generate less or even undetectable levels of those chemicals. I think that has a very important implication for the regulators. You know, if there is a way to keep the levels of those toxicants in a relatively low concentration, you know, decrease, if there are some product standards that can keep those levels low, I think is an important regulatory pathway to look at that and try to limit the emissions. What you see on the right side is the comparison with combustible cigarettes with the reference tobacco cigarettes. And across all of these chemicals, we see that the concentration in the vapor, in the emissions from electronic cigarettes, are lower than in combustible cigarettes. Today, I'm talking about the inhalation consequences of vaping. So whenever we look at the chemical composition of the aerosol from e-cigarettes, we need to look on the data on the inhalation toxicity. I know it's very confusing, particularly when it comes to flavors, because many of the actual manufacturers of the product claim that the ingredients that I use are approved as the flavorings, or they've been used as a safe ingredients for many years. It's true when it comes to the food products. The data, the toxicity data on the safety of many of these flavorings, whether they are synthetic or natural origin, they have been studied. They have been studied by industry. They have been studied by independent researchers. And for many of those, we know that they are safe to ingest. But again, when we look at the inhalation data, when we look at the respiratory effects of those chemicals, that's much more concern. And there is a lack of the data on many of those. Here's one of the example of the acetaldehyde. When you look at the safety of ingesting acetaldehyde, it's actually relatively safe. There are some acute symptoms after ingesting a large quantity of acetaldehyde, but acetaldehyde can be in a small quantity ingested without many consequences to our digestive system. But when you look at the inhalation toxicity, it's actually very potent inhalatory toxicant, and it's classified as a possibly carcinogenic chemical to human, and there are protections in place in the people working with acetaldehyde in the indoor air. So this is different. So when you look at the data about what's in the product and what might be the potential consequences for the users, I think it's very important to look what we know about the inhalation of those chemicals. When you think about a kind of pathway that all the chemicals get from the product to the body of the users, to the system, to the biological system, you can think also about the potential steps and the potential variables and characteristics of the products that may influence the toxicity of the product. So the first step is what I just discussed, is the presence of the toxicant in the product. So some product may have less impurities, some products may have a higher concentration of the impurities. It comes to the quality control of the product, it comes to the impurities from the ingredients that manufacturer puts in the product. So there might be some products that are more harmful just because they contain those chemicals inside the product, and there is no sufficient purity of the ingredients. The second step is the performance of the product. When the product is being used, when the product is activated, the heating element inside of the device generates the heat, and the mixture of those chemicals, the nicotine solution, is being heated and is being released from the device. This is really important step when a lot of dangerous or potential dangerous chemicals can be released, because when you have a heat, when you have a mixture of the different chemicals, when you have airflow with the access to the oxygen, then there's a perfect situation for chemical reactions to happen. And then the toxicants may be generated and they may be emitted from the device, and as a consequence, inhaled by the users. So then we have a user. When we have a person who inhales all of those chemicals, they might inhale in a different way. They might inhale with the different frequency, they might be using different products. So understanding how people are using the product, how deeply they inhale is also critical to estimate the potential health risk of vaping. And finally, the toxicant and the chemical goes to the respiratory symptom, is deposited can be deposited in the lungs, can be absorbed, and can be distributed across the body. So how these different characteristics may affect the delivery of the toxicants to the users. This is one of the example of the actual Juul product. This is one of the leading brand in the US. So we try to measure what is the cumulative dose that the user can get from the product. And the red dots and the blue dots represent the same product, but puff in a different way. So the red dots is the product when it was tested using Health Canada intensive protocol. This is the standardized protocol that we use actually for testing combustible cigarettes. So if we apply the same conditions for electronic cigarettes, we see, I'm sorry, these are blue dots. These are blue dots. We see that delivery of the nicotine is consistent, but it's kind of the slope of the curve. It's not so steep, so there is a slow and much slower delivery of the nicotine. However, what we try to do in this experiment, we try to measure how real users of the Juul puff on the device, how frequently and how deeply they inhale. And when we program our vaping machine to mimic that pattern, what we call the modified protocol or Juul protocol on the graph, you see that the curve, the profile shifted to the much steep slope. And that suggests that if we apply the conditions, how the user puffs on the device, more intense, more frequent, and then we see changes, that we see that the nicotine delivery, the dose of the nicotine delivery to the users is actually higher. So when we use that standardized protocol, we underestimated the dose of the nicotine that can be delivered from the product. So it's very important when you test the product to take into account the patterns of use, and if possible, try to mimic those patterns in the laboratory conditions. So coming back to the carbonyls, to the formaldehyde, acetaldehyde, acrolein, acetone. So why some products have a high levels, why the other did not? And it's been studied extensively, and I think our understanding what's going on is clear here. So it's about the temperature in the device. It's about the power of the device that drives emission of those chemicals. So if you keep the power low, that means that the nicotine solution is not overheated, it's not heated to the too high temperatures, then we see very little of the carbonyl compounds emitted from the product. When you start increasing the power, what you see on those graphs, when you start switching from the low power, this is actually voltage, but this translates to the increasing of the power of the device and the temperature of the heating element inside. So when you go to the higher settings, when you want to increase the power, then you see more and more of those chemicals emitted from the device. Again, it has the potential regulatory implications, because that suggests that under certain settings of the device, the risk to the users can be mitigated and can be kept as low as possible. But again, those are devices that users can manipulate, can change the power. Some of the devices allow, they have like a dial or a switch. And if the user wants to inhale more of the nicotine, that's what they will do with those devices. They will press the button to get more of the aerosol emitted, to increase the power and inhale more nicotine. This is what driving those behavior. They don't want to inhale the formaldehyde. They just want to inhale more nicotine. But as a consequence of the inhaling more of the nicotine, they might be exposed to higher levels of the respiratory toxicants. This is another example of our study when we look at the one of the flavorings. This is the benzaldehyde. Again, the flavoring that we know it's safe when we ingest, but there are studies suggesting the inhalation toxicity of benzaldehyde when it's being inhaled. The benzaldehyde is commonly used in a fruit flavors product, particularly in a cherry. So the benzaldehyde smells like cherry, and it gives the sensation of the cherry product. So we clearly found that the products that were labeled as a cherry, they have elevated levels of benzaldehyde. Please note that a y-axis is a logarithmic scale, so these levels are relatively high comparing to other products. And we try to estimate what is this dose compared to the environmental exposure during a day or to the dose emitted from the combustible cigarettes. And what we found in the study that dose in the cherry flavored products is actually higher than from combustible cigarettes. What is the exposure to benzaldehyde from combustible cigarettes? So the flavors matters, and the product design matter when it comes to the emission of carbonyl compounds. The flavors also matters when it comes to the emission of the other toxicants. So what do we know about the exposure to those chemicals in smokers who switch to electronic cigarettes, or overall in the population of users of electronic cigarettes? So in the studies, when we switch users, so that means we recruited smokers, we asked them to use electronic cigarettes instead of combustible cigarettes. So it's kind of cessation trial, but we use the term switching because our outcomes in the study was not cessation rates, but was more looking at the changes in the respiratory symptoms or exposure to the chemicals. So this is what we saw in the early studies. When the smokers switch to electronic cigarettes, we did not observe much changes in exposure to nicotine. So the nicotine remains stable, the nicotine exposure remains similar. That means that the users learn how to use electronic cigarettes. They titrated the nicotine to get what they wanted, to get fixed nicotine dose, similar to what they used to get from combustible cigarettes. But when we look at the exposure to respiratory toxicants, then we saw a different picture. And this is NNAL. NNAL is biomarker of exposure to respiratory, to tobacco-specific nitrosamine, lung cancer-causing chemical in the tobacco smoke. So even after the short time, we see a very rapid and very significant decrease in the exposure to this toxicant. So that would suggest that there is a potential reduction in the risk of the lung cancer in the smokers who switch to electronic cigarettes. But the significant reduction in the exposure to toxicants has been reported primarily in the exclusive electronic cigarette users. So that means those ex-smokers who completely switch to electronic cigarettes. This is where we see a significant and statistically significant reduction in the exposure. So if you look at the violet bars, the EC bars, compared to the right side of the graph, those are smokers. You can see that the reduction in the exposure, in this case to acrolein, these are the two markers of the exposure to acrolein, are significantly lower. And that suggests that the e-cigarette users are exposed to lower levels to acrolein than smokers. But when you look at the dual users, this is the second bar from the right, these are the people who continue to smoke, but now using electronic cigarettes. Many of them reported that they're using electronic cigarettes to reduce smoking. But at least in most of our studies, we did not find a significant reduction in exposure to toxicants. It will depend how much they reduce smoking. So if they really reduce from 20 cigarettes a day to one cigarette a day, then yes, we would expect a reduction in exposure. But when you look at overall the population-based studies and a large group of the dual users, we cannot observe a significant reduction in exposure to respiratory toxicants in that group. So just a summary, overall in the e-cigarette users, we see, as you know, we know that they inhale toxicants, we know that they are exposed to the different chemicals. So we are expecting that this suggests that there is an elevated risk associated with vaping. This is this absolute risk compared to not using the product at all, or not using any tobacco product at all. Compared to cigarette smokers, electronic cigarette users overall have the lower levels of biomarker associated with the respiratory risk. That suggests that there is a reduced health risk with vaping compared to smoking. So this is when we are talking about switching patterns, that we are talking about a potential for electronic cigarettes to reduce the smoking related burden. Again, in dual users, most of the study, not all of the studies, but most of the studies suggesting very little reduction or not significant reduction in exposure to harmful respiratory toxicants. So we think there is very little reduction in the dual users. What do we know about the respiratory symptoms? Here I want to show some of the novel data. This is simply cytotoxicity to the bronchial epithelial cells compared to air controls. But also what might be interesting to you is the study this study compared the toxicity, inhalation toxicity of electronic cigarette, one brand, to IQOS, to the heated tobacco product. And as you can see, there is a gradient across all of the products. So the tobacco cigarettes, this is the bar on the right side of the slide, you see that this is where the most cytotoxic product, the most toxic product among all of the product tested. The heated tobacco product, IQOS, is somewhere in between the electronic cigarette and the combustible cigarette. So there is some reduction in a cytotoxicity in a IQOS, but it's more compared to electronic cigarettes. So we might expect that, depending on the type of the product, you know, whether it's electronic cigarettes or whether it's heated tobacco product, we might see some differences. And I think that looking at the comparison of electronic cigarettes to heated tobacco products is really important, because both types of the product have a potential, or are advertised, are marketed as a potentially less risky products. But the health effects of vaping might be different to the health effects of using HTP heated tobacco products like IQOS. I showed you before the data on the effects of the flavorings on the emission of the different chemicals, and we also see the effect of the flavors in the in vitro studies. This is one of the air liquid interface respiratory cells exposed to the same product, the same nicotine concentration, but with the different flavors. And if you measure the cytokines in a system, different flavors resulted in a different concentration of inflammatory markers. So again, that suggests that these characteristics of the product, power, nicotine concentration, form of nicotine, and the flavorings will change the potential toxicity, and the users of the tobacco flavor may actually experience the different symptoms than the users of strawberry flavor. What do we know about from the animal studies? This is our exposure system in my lab when we expose the small animals, mice, to emissions from electronic cigarettes, and we can also expose them as a comparator to heated tobacco product or electronic cigarettes. These are some preliminary data, and we're looking at the markers of the immune response in the lungs of the animals exposed to the air. This study compared electronic cigarettes to heated tobacco products. So what you see on the graphs, the air is the levels of the inflammatory markers after exposure to control conditions to air. no change, very little. And electronic cigarettes are in the middle, and HNV, which is IQOS in this case, the heated tobacco product. So you see a gradient and a different effects across those different products, which HTP IQOS resulted in a higher immune response compared to electronic cigarettes. We completed the study. There is a combustible cigarette effect, which is actually comparable to HTP, or in some markers stronger than HTP, and of course electronic cigarettes. So overall, electronic cigarettes show the lowest in our settings, in our experiment, among all of the 3 types of the products that we tested. Vaping, HTP, and combustible cigarette, electronic cigarettes appears to cause the least harm compared to 2 other categories of the products. And what we know in terms of the respiratory diseases from the population or clinical trials, I focus on the upper part of this diagram. So I summarized the data. We know that there are oxidant chemicals, carbonyls, there are particulates, there are flavorings that may affect the respiratory toxicants. There's potential effect of the nicotine on the immune response, on the activation of the nicotinic receptors in the respiratory tract. And now we are getting more data on the middle part of the graph. So this is, we know there is an inflammation process going on in the respiratory tract after exposure to electronic cigarettes. There's some emerging data on the viral and bacterial infection risk in a vapors, that it appears to be impaired. So that's even in the context of the current pandemic, is really important to look at that, what's going on, and very limited data on the risk on the asthma. That's particularly coming from the young people, and there are studies suggesting increased elevated level of asthma in the young people who use electronic cigarettes. Some data on a COPD exacerbations in the users of electronic cigarettes are also emerged. But overall, we have very little evidence from the clinical trials and from the observational study on the respiratory risk. As I mentioned, the cough, wheezing in adolescents who use electronic cigarettes. Some studies suggest that there is a risk in it, and again, limited evidence from the in vitro and in vivo studies. But when we look at the relative risk, the relative respiratory risk, comparing to adult smokers, what the vapors may experience, there is emerging evidence here that vapors of the electronic cigarettes would experience less respiratory symptoms compared to the smokers. There's still limited evidence. I think we need more studies, especially the randomized clinical trials and observational studies with well-controlled conditions. So far, when we look at the respiratory symptoms in electronic cigarette users, it's really hard to control for the past smoking history. Most of our participants in our study who use electronic cigarettes regularly, who vape for some time, they have years of history of smoking. So it's really hard to know what's going on, how the electronic cigarettes contributes to the current risk, or what is being driven by the past smoking of the combustible cigarettes. And the last topic, before I summarize my talk, is that I want to mention that something that is really emerging here in the US, and I know in the context of Switzerland, it might be interesting looking at that, is the use of electronic cigarette to vape cannabis. It's an emerging trend. We know it's more and more, especially young people are using electronic cigarettes to vape cannabis. And you probably are aware about the pandemic or epidemic that we observed a few years ago in the vapors of THC-based electronic cigarettes, THC-containing e-cigarettes in the US. There was really concerning trend at the time. There was a product on the market that contained a specific contaminant, a specific chemicals. There was vitamin E acetate. There was additive used by some manufacturers, inside the same products. And even though we don't know everything about the EVALI pathology and etiology so far, but there is a clear evidence that suggests that this additive, vitamin E acetate, was responsible for those epidemic. It's a highly lipophilic substance. It's an oily substance that is not easily absorbed through the lung. So that's why we saw a high deposition of the vitamin E acetate in the lungs of the users of those products. We also know that it's not stable product. When it's heated, it emits the very reactive toxicants. And so it's what has been suggested so far, that the vitamin E acetate was a primary culprit of the EVALI in the US. So in a summary, while e-cigarettes are not without a health risk, including the respiratory health risk, the data so far suggests they are likely to be far less harmful than combustible tobacco cigarettes. So there is a potential for the harm or risk reduction in the smokers if they switch to electronic cigarettes. Overall, from the in vitro laboratory studies, we know that e-cigarettes contain fewer numbers and lower levels of toxic chemicals than conventional cigarettes. It's also been confirmed by the biomarker exposure studies. The long-term respiratory health effects of vaping are not yet clear. And again, it's the challenge looking at the past history of smoking, but also it's a challenge looking at the young people. And I think this is why we see some early symptoms of the risk, because those young persons who are vaping did not smoke in the past. And when you take into the consideration all of the variables, and I've been working with my colleagues who do actually simulation of the potential implication, potential population-wide implications of vaping, they take into consideration various variables, whether there is a substantial reduction in the risk, how many people are switching to electronic cigarettes, what is intake among the young people. And even if they simulate the more pessimistic scenario, they came out with the conclusion that the potential net public health benefits of allowing e-cigarettes or giving the access of electronic cigarettes to smoker is beneficial for the population as a whole. So that's it from me. Thank you so much for your attention, and I'm happy to answer questions.
Thanks so much, Maciej, for this brilliant talk and well-balanced. Maybe we can open up the discussion for questions, and since we're not that many, you can also directly turn up your video, put your mic on, or raise the hands to react and directly ask a question. So I don't see everything. So if somebody wants to say something, please directly speak while I do. Maciej, we're in Switzerland. It's usual that people don't ask a lot of questions. I know in the US, everybody's so.
I can see one question in the chat box actually.
Yeah, exactly. Oh, I'm sorry. Yeah, that's right. That was from Ben Spischer, and I think it was at the beginning. So Ben, you did Maciej answer your question, because I think it was at the beginning. Maybe you want to clarify or.
Yeah. So. I don't know, is Ben still on a call? Then I can ask. So the question was about the comparisons of, I'm assuming, the toxic emissions or the testing of the product per puff. So Ben was asking whether is this comparison a meaningful one, and should be done per quantity of nicotine delivered, as that determines the frequency of use and number of puffs that the smoker will take. Yeah, that's an excellent point. I agree. What I try to emphasize that there are those all variables that need to be taken into account. So the way user is using the product it's so important. The way they puff, the way the frequency of puffing, I think that one of the interesting example is the is a discussion about the limiting of the nicotine concentration in the electronic cigarettes. And I don't know, in Switzerland you follow the 20 milligrams, or yes you do. And I know that that many countries are thinking about limiting it, and this 20 milligrams is some old estimation that kind of stayed in the regulatory framework, and everyone is talking about a 20 cutoff point. So this is this kind of paradox, because what we saw in our study, this will be published soon, is that when you look at the users of low concentration, in our study, those are people using the mod system, the large devices, the powerful devices, and they primarily use about 3 to 6 milligram per milliliter nicotine. And we compare different outcomes, including the exposure to including an exposure to nicotine, but also the respiratory symptoms and patterns of use with the joule users or pod users. So the people who use 50 milligrams per milliliter of nicotine. Actually, the nicotine exposure is the same. Both types of the users, and they are long-term users, they've been using the product for a long time, the nicotine intake do not differ. So it doesn't matter how much you put nicotine in the product, the users kind of match the same pattern of the exposure. But what was different was when we were looking on how much they vape. So in terms of how much e-liquid, how frequent they vape. And the users of highly concentrated product actually inhale much less, which makes sense. It's kind of like drinking strong coffee and light coffee. You need to drink much more of the weak drink to get the boost, to get the effect when you're drinking highly concentrated espresso, for example. Excuse me. So it's this paradox, because you might be concerned that, okay, putting much more nicotine in a product, you make the product more addictive, you make a product more, the abuse liability of the product may be increased, which has an implication for the young people. There is no doubt, people who never smoked. But for the smokers, it might have an opposite effect. It actually may reduce potential harm of vaping, because they will be vaping less, they will be using product more frequently. And I don't want to spoil the results, but we are looking at some of the respiratory symptoms in those two groups. We are looking at the markers of the inflammation. And if it's confirmed by the biological effect, if we really see that those users of the highly concentrated nicotine product inhale less, that's what we know already. But they also have a less risk of the respiratory symptom. That will have important implication for the product regulation, for example.
Excellent. So that's a very good segue to the question from Maciej Secker about the implication for harm reduction, smoking cessation, and I think also this question of the nicotine concentration, looking at the rates of young people vaping in the US versus Europe. It's this balancing act, which is difficult, but maybe in a general term, what would you say, would you answer to your take of the regulation aspect of
e-cigarette? Yeah, so I know that different countries that I'm working with regulatory agencies across the world, and they have different approaches and different priorities. And I think identifying those priorities is really important. Some countries that went into much more strict approach, when the primary concern was intake of the product among the young people, potential of vaping causing the new epidemic of vaping, and those concerns, if those concerns are taken seriously, then the regulators are more willing to restrict the market or ban the product altogether. If you see the opportunity for the product to reduce the burden of the smoking, then you need to find a way how to do that, how to make the product available for smokers, how to give the opportunity to smokers to use it. UK that I used to work with had this type of approach. They are very pro e-cigarette. I think many people consider this country as being very open to electronic cigarettes. And as I mentioned a few days ago, there was the same discussion in Lausanne that the UK was very consistent in messaging to the population there. Everyone was saying the same thing. This is the product for smokers. This is what smokers should be using, which I think is very different what we see in the US, because those messaging is actually very different. It's for many reasons is different, but vaping companies that market the product in the US actually don't talk anything about the smoking. They promote the product as the cool product, as a, trendy, as the very fancy way to enjoy your life. There is nothing in the messaging about the product, about this potential harm reduction, about the potential benefits to the smokers. Again, it's for many reasons, including the regulation constraints, including the marketing constraints. But that might be one of the explanations why we see differences across the countries, why some countries see more intake of the e-cigarettes among the smokers, while the other countries among the young people. There might be other factors, of course, as well. So in terms of that, just to summarize the question, so what are the implications for the regulation and public health policy? I think there is some potential. If you want to regulate the product, there is a potential for the product standards to allow the product on the market, but keep it as safe as possible. So have some control over the products that might be contaminated, that might, the manufacturers might put something like vitamin acetate that will cause the significant harm to the vapors. So there is an opportunity there for regulation of the product. There is an opportunity for regulating the access to the product, where it should be available, whether it should be pharmacy, whether it should be specialized vape shop with restricted access to the young people, the age verification, etc. That's something to consider for the regulatory. Yeah, I think that's it for this question.
So maybe for the next question about young explosive user increasing nicotine concentration over time, I think my question, because the time is short, overall with these e-cigarette question regulation by young adults, we sense that the question is less scientific as a question of values, how we go on with nicotine and nicotine addiction as a value and moralistic judgment versus more a human's right issue with nicotine is associated. So maybe this question points also to that point, and I want to hear from you if you also see some value-based rejection or acceptance of e-cigarette in regulation.
Yeah, again, it depends on the context of the country, and there are cultural differences. I was always kind of surprised with the countries like in Asia that actually that's where the burden of smoking is so high. That's where we see 50% of the society smoking. Those countries are very reluctant to e-cigarettes. They don't want to see electronic cigarettes. That's where you see most of the banning of the e-cigarettes on a market. The countries that kind of control that epidemic or doing what they should be doing in terms of the restricting the e-cigarette, the tobacco cigarette access. They are more open to e-cigarettes, and so it's I don't know. It's a cultural difference. It's a country difference. It's a difference in a regulators, and I'm not the expert to give that kind of advice. I think I see the potential. There is no doubt. There is and I think everyone agree. Everyone agree that there is a potential for e-cigarettes for smokers, and everyone agree that there is a risk of the young people using the product. And so how we do that, how we deal with those two extreme situations, how we can minimize the risk to the young people, how we can boost or on maximize the benefit to the smokers. I think we always need more data to explain that, and this should be driven by the science. Right now, it's a lot of discussion, is a lot of opinions, but if we can get actual data, what works, what kind of policy works to do the job, I think that would be great to get those.
Wonderful. So I know it's we had 1 hour scheduled and we're over time. So I see there's still some questions. One of the questions was about the references. If maybe we'll be able to have maybe a last slide with the references so that the person who requested it maybe can find it. Any last comment you want to give to the Swiss audience, being the country of harm reduction in other drugs? What would be your take of how Switzerland, being also similar in the absence of good control of tobacco, about e-cigarettes?
Yeah, I mean, I always thought that it's important to, one is important to compromise and to listen to different opinions and listen to the different points of view. And of course, there will be discrepancy. Everyone has the strong opinions about electronic cigarettes. It's been controversial topic for years, and it remains like that. Look at the science, look at the evidence. There is more and more evidence from science, and we rely on the preventive measures for COVID, on the experiments, data from the experiments, from clinical trials. And we should do that the same for deciding what to do with electronic cigarettes. The data are there. There's multiple studies ongoing. There are studies that have been published almost every day. So we get more and more data, and I think I'm advocating as a scientist to look always at the evidence-based, regulation.
Wonderful. So thanks so much. So that's energizing that at least you will also notice the results from the Extend study we're conducting now, and we hope we keep in touch. And in any case, many thanks for your talk, your time, and for the excellent questions from the room. And with that, I suggest we close this discussion. So thanks so much, Maciej, and thank you so much for participating.